Now, for those parents who are going to think about taking their child to go see an allergist for their asthma, are there useful things that they can do before they go in to see you?
So I think the most important thing to do is be well organized to come in with a history, okay? Because sort of when people come in all over, then it becomes very difficult. So it's really nice if parents have like a timeline. When did the symptoms start? What have they been treated with? And if they sort of have that organized, it really helps the doctor help evaluate them. The other thing that they can help do is bring in all the medicines that the patient is taking or has used or has tried, because the dosages are really important to know what that child has tried, what's worked, what hasn't worked, and maybe they're on too low of a dose or the wrong type of medicine, and that will really help the doctor out. So coming as prepared as you can is ideal.
Okay. For a first visit, what could a parent expect with their child?
So usually what I do in my office, and obviously every office is different, I bring both the parent and child into my sort of private office, and we talk, and I get a history for the first 15 to 20 minutes as I watch the child run around and break everything in my office. And then I bring the child in to examine them, okay? And then after I examine, well, then we talk about what we plan to do. And what we plan to do can involve several different things. One, if the child is old enough, we have them do a breathing test where they actually breathe into a machine, and we actually can look for evidence of airway inflammation and obstruction in their lungs. And we often give them something to see how well they respond to medicine. We can often give them a medicine and see how they do after the medicine 15
Mhm.
minutes later. Another thing that we may or may not do is do allergy testing, okay? And that's actually a fairly easy process where we put little pricks of fluids that have different allergens onto their skin and watch and see if we get a response or not. I always tailor it towards what seems to be going on there's not a standard protocol that I do. It always depends on the patient's history,
Sure.
and sometimes what the patient's looking forward to or wants to have done as well. Because sometimes, I may not even think a patient necessarily needs to be allergy tested, but they want to be allergy tested, so we allergy test.